I'm 14 years old, and I was diagnosed when I was 15 months old.
She was walking when she was 13 months old, and then when she was 15 months old, all of a sudden she starts crawling, and I looked at her knee and it was huge. I took her to the pediatrician immediately put her in the hospital, and very soon after we got the diagnosis of juvenile rheumatoid arthritis.
Did you even know at that time, Stephanie, that there was a disease called juvenile arthritis?
No, but I guess as a mom you just kind of don't realize that it could be forever. So I was really under the impression that they would give us some medicine and it would go away. As she was, getting worse, you really realize what you're in for. This was something that, she was most likely going to have, the rest of her life.
It is important to refer early because we know the sooner we decrease inflammation, the better the child is going to do, the less destruction to the joint, the less change in mobility to the joint.
Immediately, they put her on different types of drugs that obviously a pediatrician wouldn't have, been able to do.
Well, I've been living with it for a long time now, and it's really hard because you have to take lots of medication. When it's acting up, sometimes I can't even get out of bed. Sometimes getting out of the shower is just hard when I'm having a bad day.
Even, going to a place like Disneyland, how fun is that? But we have to rent a wheelchair because it's just too much walking for her. Arthritis is always there.
And they don't want to look different in school. They really don't want to look different. So they try their best to keep up as much as possible.
No, I'm trying really hard to be able to go through the pain and really be a cheerleader because that's what I've wanted to do for so long.
They do keep on keeping on despite everything. I think the relationship that probably many pediatricians, and certainly in pediatric rheumatology, we develop with our patients is unique. I've known many of the children since they were small.
She's the sweetest thing, and I feel like I'm just talking to a family member.
When she makes achievements and gets awards, it feels very good.
What do you think is the most important thing that you as a parent, or for any parent, can do for their child that's going through a disease like this?
You just have to be an advocate for your child, and you have to tell your child to be an advocate for themselves.
Even though on the outside I look okay, and the inside sometimes I may be hurting, but I just try to put a smile on. And whenever you go to the store, you'll see people advertising all these different diseases and asking if you want to donate, but no one ever asks about arthritis, so I really want it to be known, and I want people to know that kids get arthritis too, and I want to be able to have a drug that can help us all feel better and maybe even get some of us into remission.